Hi, this is Colleen Parsons with Part 3, the Musculoskeletal Assessment. When doing your physical examination, you don't really need tools per se for your patient. You just need to be able to physically assess them with your through inspection and palpation. So you want to look at the size and the contour of the joints, inspecting the skin and tissue over the joints for any swelling. You're going to palpate. You're going to be careful. So you're going to start with gentle palpation, and then you're going to go fairly deep, asking them with every joint if there is any pain or discomfort in those areas. You're going to be particularly aware of areas that require a lot of movement: elbows, shoulders, knees, ankles, hips. You're going to ask your patient to do range of motion, specifically as it says in the skills assessment, but that doesn't limit you, so you want to be able to watch them actually moving. Do they move? Does their jaw move when they talk to you? Or are they stiff? When they go to shake your hand, does that look like it's comfortable, or are they refusing to shake your hand? Those are the things you want to be looking for. Any tenderness at all. You're going to test their strength in a couple of different ways. So you're going to check for resistance, right? You've already assessed for TMJ, but with the muscle assessment, you would assess for that again. The cervical spine is very important, so you've assessed their neck in the past, but you're going to assess it again, and it's going to be different. You're paying attention to the cervical vertebrae and the muscles in the neck. Shoulders, you're going to inspect the shoulders. You are going to look for range of motion in the shoulders, comfortability. People often have very stiff shoulders or movement limitations in their shoulders. So you're going to be looking for any heat or warmth out of the ordinary, and redness, swelling, and limited range of motion in all of these areas. The wrists and hands are important too. You're going to be looking for difficulty with their hands. Men who've used their hands a lot can get, besides arthritis, and women too, but men will get this weird sort of cramping in their hands. And then there is also, a carpal tunnel, where it just really hurts because you've used your hands in the same way, in the same repetitive movements over and over. Oh, do we do the Fallon's test? I think we do. So you hold your hands, both hands back to back, while flexing your wrists in a 90-degree angle and looking for any pain or difficulty doing that. And you do that for about 60 seconds. If no symptoms are produced, then they're free of carpal tunnel. Carpal tunnel also brings with it numbness and burning, so there's a neurological component to carpal tunnel. This is a very good picture of a bulge sign in the knee. You can see where all the fluid is right above there. So you're palpating, you're inspecting, you're testing for range of motion, especially if they tell you that something hurts. So the spine, you have your patient stand up. They're draped in a gown, which is open at the back, and you are looking. You're really looking at that spine. Is it straight? And then you have them bend over so that you can look at the spine as they're bent forward. You're going to also palpate the spine, looking for anything that might feel like it's out of place. You're looking for symmetry, as in most things. And you are not going to do range of motion on your patients. You can ask them, you're watching them move. So can they raise their feet? We're not going to do this either. And there are a couple of really easy ways to measure the length of the hands or feet, and I'll try to remember to show you this, or legs and arms. I'll show you this in class, but it's really easy to just put your hands together where they're pretty close and have the patient extend fully, and you're putting your fingers right at their fingertips, or your palms right at their fingertips, so that you can see if they are equal. And you do the same thing with their feet. Actually, with the bottom of their feet, not their toes. You don't want them to point their toes. And you're looking for almost exact. Things can be off a little bit. Not going to go into babies too much, but you are definitely looking for developmental competence. Are they progressing as they should? Are they meeting all of those milestones? Can a newborn baby hold its head up at, I think it's 8 weeks, it should be able to hold its head up. I can't remember right now. And are they able to move their limbs comfortably, or do they cry a lot when being held? If they're crying a lot when being held, then that might give you an indication of a broken bone. School-age children, you definitely want to look at them for all different kinds of signs and symptoms. Some of them will be nutritionally related, like rickets or scurvy. We don't see scurvy very much anymore, but there is a family in Elmira that has rickets. They weren't fed correctly as children, so they're very bow-legged and deformed as a result. Developmental competence in adolescence. What do they do? How do they move? This is a really important time to be looking for scoliosis, so some twisting of the spine, and it's more probable to see it in women than in men, especially at this age. There is a considerable amount of thought that it is hormonally related. And as in all things, pregnant women have many changes. The good news is it does change back, but pregnant women do have a lot of back difficulty carrying their baby, and as the muscles and ligaments relax, they can really have difficulty moving. Aging is not a friend to the muscles and the skeletal system. So you actually shrink over time. Some of it's gravity, and some of it is how arthritis is reshaping your spine. So kyphosis, of course, is common. You've also got bony prominences that are more visible than they once were. And part of that is because gravity is taking everything and just pushing it down a little bit further. So you also lose a significant amount of muscle mass, and it's hard to regain it. You'd have to work so much harder. So for our aged people, we're looking especially at their functional assessment. Can they get in and out of the shower? Think about safety first. Always think about safety first. What would be dangerous for this patient to do, and see if they can do it. Then you're also looking at just what makes their life, increases the quality of their life. It is not uncommon for multiple joints and parts of the body to be affected, especially with degenerative joint disease, osteoarthritis, osteoporosis, or any kind of arthritis. And then we'll continue to go through the different abnormalities, such as a shoulder, tear in a rotator cuff early on. If it hasn't been repaired, it can become significant trouble for the patient later on. Gout doesn't just happen in the toes. It can happen especially in the elbows. Tennis elbow is pretty common. Carpal tunnel, ganglion cysts. If you remind me in class, I'll tell you about that. Conditions caused by chronic rheumatoid arthritis, swan neck, degenerative joint disease or osteoarthritis. There are just so many side effects. Abnormalities of the knee, swelling of the meniscus, usually one side or the other. Post-polio syndrome. Post-polio syndrome is a pretty big deal. And for whatever reason, I'm not remembering what Musculoskeletal disease is, and I'm trying to remember because it is kind of important. So look that up. Oh, it's there in the tip of my tongue somewhere. Ankles and feet. So if you have plantar warts, that would be a skin issue, or an ingrown toenail. Those are skin and nail issues, but they affect the way we walk. So pay attention to those. Bunions and hammer toes are a physical deformity that grows over time. Gout, what we usually call Achilles tendonitis, or they have a longer name for it there. Scoliosis is a very big deal, and herniated discs are a very big deal for patients, causing a lot of pain and difficulties through time. Spina bifida. Infants are born with spina bifida, which is the spine and some of the internal organs protruding through the skin of the back. Things aren't quite put together the right way. That is not uncommon. You'll see that in your nursing career, no matter where you work. Club foot is not uncommon. And like I mentioned before, congenital dislocation of the hip is pretty common. And that's the end